In the sterile corridors of Metropolitan General Hospital, whispered conversations stopped abruptly when Dr. Marcus Wellington's footsteps echoed down the hallway. For 3 years, this man had turned what should have been a place of healing into a battlefield of fear. Nurses requested transfers to other departments. Medical residents broke down in bathroom stalls after his brutal verbal attacks. Even seasoned surgeons avoided eye contact when he passed by. The hospital administration knew they had a problem, but Dr. Wellington was brilliant. His surgical success rate was unmatched, his research brought prestige to the institution, and his connections in the medical community were invaluable. So they looked the other way while good people suffered in silence. But everything changed the day Sarah Chun walked through those same hospital doors for her first shift. She carried with her a quiet confidence that no one quite understood yet, and a past that had prepared her for battles far more dangerous than facing one intimidating doctor. This is the story of how one nurse succeeded where an entire medical staff had failed, not through confrontation or complaints, but through something far more powerful, genuine human connection, and the courage to see beyond the monster everyone else feared. The transformation that followed would shock everyone who witnessed it, proving that sometimes the most broken people just need someone brave enough to reach out their hand. Dr. Marcus Wellington stood 6 feet tall, with sharp gray eyes that seemed to cut through people like surgical instruments. His reputation at Metropolitan General Hospital preceded him into every room he entered. Staff members would literally scatter when they heard his voice approaching, like birds fleeing from a predator. The morning routine on the 7th floor was always the same. Nurses would gather around the station at 7:30, reviewing patient charts and discussing care plans in hushed tones. But the moment they heard the distinctive click of Dr. Wellington's expensive leather shoes against the linoleum floor, conversations would die mid-sentence. Jennifer Rodriguez, a nurse with 8 years of experience, still remembered her first encounter with him 2 years ago. She had accidentally mixed up 2 patient files, a simple mistake that could have been corrected quietly. Instead, Dr. Wellington had humiliated her in front of the entire nursing staff, questioning her competence and suggesting she might be better suited for a desk job. The incident left her questioning her abilities for months. The emergency department staff had their own horror stories. Dr. Wellington would storm through during his consultations, barking orders and criticizing treatment decisions made by other doctors. Dr. Amanda Foster, an emergency physician, once watched him reduce a young resident to tears because the resident had used the wrong terminology when presenting a case. What made Dr. Wellington particularly dangerous was his inconsistency. Some days he would be merely cold and professional. Other days, he would explode without warning over the smallest infractions. A nurse named Michael Thompson learned this the hard way when he dared to suggest an alternative pain management approach for one of the doctor's patients. Wellington's response was swift and brutal, questioning Michael's education and experience in front of the patient's family. The hospital's administration was well aware of the situation. Human Resources had received dozens of complaints over the years, ranging from verbal abuse to creating hostile work environments. Director Patricia Mills had tried addressing the issue multiple times, but Dr. Wellington's responses were always calculated and professional during these meetings. He would apologize with just the right amount of sincerity, explain that he was simply passionate about patient care, and promise to work on his communication style. Then, within days, he would be back to his old behavior, sometimes worse than before, as if the complaints had only fueled his anger. The real problem was Dr. Wellington's value to the hospital. His surgical skills were genuinely exceptional. Patients traveled from neighboring states specifically to have him perform their operations. His research on cardiovascular procedures had been published in prestigious medical journals, bringing recognition to Metropolitan General. The grant money he attracted through his research projects funded entire departments. Hospital board members found themselves in an impossible position. They couldn't ignore the staff complaints, but they also couldn't afford to lose someone of Dr. Wellington's caliber. Other hospitals would eagerly recruit him if Metropolitan General let him go, taking with him not just his skills, but also his research funding and prestigious reputation. The compromise they reached was typical of institutional thinking. They implemented sensitivity training programs, established anonymous reporting systems, and created committees to address workplace harassment. These measures looked good on paper and satisfied legal requirements, but they did nothing to change the daily reality for the people who had to work alongside Dr. Wellington. Meanwhile, the doctor seemed to take perverse pleasure in testing the boundaries of these new policies. He would make comments that were technically within guidelines, but carried clear undertones of threat or intimidation. He mastered the art of demeaning people through tone and body language while using words that couldn't be easily reported. Nurse Maria Santos, a single mother of 3 who desperately needed her job, learned to time her rounds to avoid crossing paths with him. She would wait in supply closets if necessary, listening for his voice to fade before emerging to continue her duties. The stress began affecting her health, but she couldn't risk complaining again after her previous report had somehow made its way back to Dr. Wellington. The psychological impact on the staff was devastating. Sick days increased dramatically on the floors where Dr. Wellington worked regularly. Turnover rates soared as experienced nurses and doctors requested transfers or left the hospital entirely. The quality of patient care began to suffer as staff members became more focused on avoiding Dr. Wellington's wrath than on providing optimal treatment. Young medical students and nursing students dreaded rotations that involved working with him. Some changed their career paths entirely after experiencing his verbal abuse. The hospital was losing not just current staff, but future medical professionals who might have thrived in a different environment. Dr. Wellington's behavior created a culture of fear that extended beyond his direct interactions. Other staff members began adopting similar harsh communication styles, believing this was what was expected in a prestigious medical environment. The toxicity spread like an infection through the hospital's hierarchy. Patients and their families began to notice the tension. Some specifically requested not to work with certain staff members who seemed nervous or distracted. Others complained about the cold, unwelcoming atmosphere in certain departments. Patient satisfaction scores in areas where Dr. Wellington worked regularly were consistently lower than in other parts of the hospital. The financial cost was significant. High turnover meant constant recruitment and training expenses. Temporary staff had to be hired to fill gaps, costing much more than regular employees. The hospital's reputation in the nursing community made it difficult to attract quality candidates, forcing them to settle for less experienced applicants or pay premium wages to lure nurses from other institutions. Insurance claims related to workplace stress began to appear more frequently. Several former employees had threatened legal action, though none had followed through, likely due to concerns about their future careers in the medical field. The legal department was spending increasing amounts of time and money addressing these potential liabilities. Most tragic of all were the personal stories hidden behind statistics. Sarah Kim, a brilliant young nurse, had started having panic attacks before her shifts. David Chun, a respiratory therapist, began drinking heavily to cope with the stress of potentially encountering Dr. Wellington during emergency calls. Lisa Martinez, a nurse practitioner, developed insomnia and was prescribed anxiety medication by her own doctor. The breaking point came during a particularly difficult evening shift in late autumn. Dr. Wellington had been called in for an emergency surgery, and his mood was already dark due to being pulled away from a social event. When nurse practitioner James Wilson attempted to update him on a patient's condition, the doctor exploded with such fury that his voice could be heard throughout the entire floor. Patients in nearby rooms became alarmed, with some thinking there was a medical emergency. Family members in the waiting area began asking questions about the shouting. Security guards arrived to investigate the disturbance, only to be told it was just Dr. Wellington having another outburst. The incident was finally too public to ignore. Videos taken by concerned family members on their phones began circulating on social media. Local news outlets picked up the story about the prestigious hospital where staff were apparently being abused. The hospital's carefully maintained public image was beginning to crack. Board meetings became increasingly tense as members debated how to handle the situation. Some argued for immediate termination, regardless of the financial consequences. Others insisted they needed to find a way to address the behavior while keeping Dr. Wellington's valuable contributions to the hospital. The medical staff was losing faith in the administration's ability to protect them. Union representatives began making inquiries about organizing formal complaints. Several department heads threatened to resign if something wasn't done soon. The crisis was reaching a point where the hospital's very functioning was at risk. Sarah Chun walked through the automatic doors of Metropolitan General Hospital on a crisp Monday morning in November, carrying a simple black bag and wearing the confident smile of someone who had seen enough of the world to not be easily intimidated. At 32, she brought with her 15 years of nursing experience, including 5 years in military field hospitals and 3 years working in some of the most challenging urban emergency departments in the country. Her resume alone should have been enough to impress any hospital administrator. She held multiple certifications, had received commendations for her work in disaster relief situations, and had trained other nurses in trauma care techniques. But what truly set Sarah apart was something that couldn't be printed on paper, an unshakable inner strength that came from overcoming challenges most people couldn't imagine. Sarah's childhood had been spent moving from one military base to another as her father served as an Army medic. She learned early in life how to adapt quickly to new environments, how to read people's emotions beneath their surface presentations, and how to remain calm under pressure. These skills had served her well throughout her career, but they would prove especially valuable in her new position at Metropolitan General. During her interview process, several staff members had subtly tried to warn her about Dr. Wellington without directly criticizing their colleague. The nurse manager, Linda Patterson, had mentioned that the cardiovascular department could be challenging and that it required nurses with thick skin. The hospital director had emphasized the importance of professional resilience and maintaining composure in difficult situations. Sarah had listened to these coded warnings with interest, but not alarm. She had worked alongside difficult personalities before, including surgeons with legendary tempers and military officers who ruled through fear. She understood that brilliant people sometimes struggled with interpersonal relationships, and she was confident in her ability to navigate such situations professionally. What the interviewers didn't know was that Sarah had specifically requested this position because she thrived in challenging environments. After years of working in crisis situations, she found traditional hospital settings somewhat boring. The opportunity to work with a renowned surgeon like Dr. Wellington, despite his reputation, actually appealed to her sense of professional adventure. On her first day, Sarah was assigned to shadow Jennifer Rodriguez, who had been designated as her training supervisor despite her own troubled history with Dr. Wellington. Jennifer was nervous about the arrangement, knowing that training new staff often attracted unwanted attention from the difficult doctor. As they made their morning rounds, Jennifer provided detailed instructions about patient care protocols, but Sarah noticed she seemed more focused on avoiding certain areas of the floor. When Sarah asked about the timing of their route, Jennifer admitted they were deliberately working around Dr. Wellington's usual schedule. Sarah listened with growing fascination as Jennifer shared stories about the doctor's unpredictable moods and explosive outbursts. Rather than feeling intimidated, Sarah found herself curious about what might be driving such behavior. In her experience, people who acted out aggressively were usually dealing with pain or fear that they couldn't express in healthier ways. Her first encounter with Dr. Wellington came sooner than expected. They were reviewing charts at the nursing station when his distinctive footsteps announced his approach. Jennifer immediately tensed, shuffling papers nervously and avoiding eye contact. Other nurses in the area found sudden, urgent tasks that required their attention elsewhere. Dr. Wellington appeared around the corner, his tall frame commanding the space as he surveyed the area with those sharp gray eyes that had intimidated so many others. He was looking for the nurse assigned to patient room 714, who had apparently made an error in medication timing. Jennifer glanced at Sarah with obvious panic. The patient in question was one of theirs, and the mistake had been a simple miscommunication that Jennifer had already corrected. But she knew from experience that Dr. Wellington wouldn't care about the resolution, only about the initial error. To everyone's surprise, Sarah stepped forward calmly. She introduced herself as the new nurse and explained that she had been reviewing the case with Jennifer when they discovered and corrected the timing issue. Her voice was steady and professional, neither defensive nor apologetic, simply stating facts. Dr. Wellington turned his attention to this new person who had dared to address him directly. Sarah met his gaze without flinching, maintaining respectful eye contact while she explained the situation. She acknowledged the mistake, outlined the steps they had taken to correct it, and assured him that the patient care had not been compromised. For several moments, Dr. Wellington studied Sarah with obvious surprise. He was accustomed to nurses who either cowered in fear or became defensive when confronted. Sarah's calm, straightforward approach caught him off guard. He responded with his typical sharpness, questioning whether new staff were properly trained before being assigned to his patients. Sarah listened to his concerns without visible reaction, then acknowledged that training was indeed crucial for patient safety. She mentioned her background in trauma care and her commitment to maintaining the highest standards. Her response was neither submissive nor confrontational, simply professional. The encounter lasted only a few minutes, but its impact was immediate. Other staff members who had witnessed the interaction were amazed that Sarah had emerged unscathed. Some wondered if Dr. Wellington was having an unusually good day, while others speculated that he might be going easy on her because she was new. Over the following days, Sarah established herself as a competent and reliable team member. She learned the hospital's procedures quickly, built rapport with patients and their families, and proved herself capable of handling the demanding pace of cardiovascular care. Most importantly, she seemed genuinely unaffected by the atmosphere of tension that surrounded Dr. Wellington. Her colleagues began to relax slightly when Sarah was around, knowing that she could handle any unexpected encounters with a difficult doctor. They started sharing more details about their experiences, perhaps hoping that Sarah might succeed where they had failed in finding a way to work peacefully alongside Dr. Wellington. Sarah listened to these stories with genuine interest, asking thoughtful questions about specific incidents and the doctor's patterns of behavior. She was building a mental profile of Dr. Wellington that went beyond the simple categorization of him as a difficult person. During her second week, Sarah observed Dr. Wellington interacting with patients and their families. She noticed that his bedside manner, while formal, was actually quite good. He explained procedures clearly, answered questions patiently, and showed genuine concern for patient outcomes. The contrast between his professional interactions with patients and his harsh treatment of staff was striking. This observation led Sarah to wonder what might be causing such different behaviors. In her experience, people who were cruel to colleagues but kind to patients often struggled with issues related to control, respect, or professional insecurity. She began to wonder if Dr. Wellington's aggression towards staff might be masking deeper vulnerabilities. Her theory was tested during a particularly stressful emergency situation. A patient had developed complications during recovery, and the entire team was working frantically to stabilize the situation. In the midst of the chaos, Dr. Wellington barked orders at everyone around him, his stress manifesting as anger toward the people trying to help. Sarah noticed something others had missed: the slight tremor in his hands as he worked, the way his jaw clenched when he thought no one was looking, the brief moments of uncertainty that flashed across his face before he covered them with aggression. These were signs of someone under enormous pressure, not someone who enjoyed intimidating others. After the emergency was resolved and the patient was stable, Sarah made a decision that would surprise everyone, including herself. Instead of avoiding Dr. Wellington as others did, she approached him to discuss the case. She had noticed a particular technique he had used during the procedure that she hadn't seen before, and she was genuinely curious to learn more about it. Dr. Wellington was initially suspicious of her interest, assuming it might be some form of criticism disguised as a question. But Sarah's inquiry was genuine, and her follow-up questions demonstrated real understanding of the medical complexities involved. For the first time in years, someone was engaging with Dr. Wellington about his work without fear or hidden agendas. The conversation lasted only a few minutes, but It marked the beginning of a subtle shift in their interactions. Sarah had shown Dr. Wellington something he hadn't experienced in a long time: professional respect combined with personal courage. She wasn't afraid of him, but she also wasn't trying to challenge or change him. She was simply treating him as a colleague worthy of normal human interaction. Word of Sarah's approach began to spread among the staff, though opinions were divided. Some admired her courage and hoped her success might improve the overall working environment. Others worried that her apparent immunity to Dr. Wellington's abuse might be temporary, and that she was setting herself up for an even more spectacular downfall. Jennifer Rodriguez found herself caught between admiration and anxiety as she watched Sarah navigate interactions with Dr. Wellington that would have terrified other staff members. She began to wonder if the problem had been their own fear rather than the doctor's behavior, though she couldn't quite bring herself to test that theory personally. As Sarah completed her third week at Metropolitan General, she had established herself not just as a competent nurse, but as someone who might hold the key to solving the hospital's most persistent personnel problem. She didn't yet realize the full extent of what she was attempting, but her natural approach to difficult people was already beginning to create small cracks in the wall of fear and hostility that had surrounded Dr. Wellington for years. By her fourth week at Metropolitan General, Sarah Chun had developed what other staff members began calling the Sarah effect. Whenever she was working, the atmosphere on the floor seemed lighter, even when Dr. Wellington was present. Her calm confidence appeared to be contagious, giving other nurses the courage to perform their duties without the constant fear that had plagued them for years. The transformation wasn't dramatic or sudden. Instead, it was a series of small moments that gradually shifted the dynamic between Dr. Wellington and the nursing staff. Sarah's approach was simple but revolutionary. She treated him like a normal human being rather than a monster to be avoided or appeased. During a busy Thursday morning, Sarah noticed Dr. Wellington struggling with what appeared to be a technology issue on one of the computer terminals. While other staff members would have pretended not to notice or waited for him to ask for help, Sarah simply walked over and offered assistance. She showed him a more efficient way to access the patient information he needed, treating the interaction as a routine collegial exchange. Dr. Wellington accepted her help with obvious surprise, but also with something that might have been gratitude. For someone who was accustomed to people either fearing him or trying to challenge his authority, Sarah's straightforward helpfulness was completely unexpected. The real breakthrough came during a particularly difficult case involving an elderly patient with multiple complications. The patient's family was demanding constant updates and second opinions, creating additional stress for everyone involved. Dr. Wellington was scheduled to perform a high-risk procedure, and the pressure from all sides was clearly affecting his usual composure. During the preoperative preparations, Dr. Wellington snapped at a young nurse who had asked a routine question about the patient's medication allergies. The nurse, clearly new to the hospital, looked devastated by the harsh response. Other staff members pretended not to notice, following their usual strategy of avoiding involvement in such situations. Sarah made a different choice. After ensuring the young nurse was okay, she approached Dr. Wellington privately. Instead of criticizing his behavior or defending her colleague, she simply acknowledged the difficulty of the situation they were all facing. She mentioned that everyone was feeling the pressure from the patient's family and the complexity of the case. Her words were carefully chosen and delivered without judgment or confrontation. She wasn't trying to lecture him about appropriate workplace behavior or demand an apology. Instead, she was acknowledging the stress they all shared and suggesting they work together to manage it effectively. Dr. Wellington's initial response was defensive, but he quickly realized that Sarah wasn't attacking him. She was actually offering support and understanding, something he hadn't experienced from nursing staff in years. The conversation lasted only a few minutes, but its impact was significant. During the surgery that followed, Dr. Wellington's interactions with the surgical team were noticeably more professional and less aggressive. The procedure went smoothly, and the patient recovered without complications. Afterward, Dr. Wellington made a point of thanking the entire surgical team, including the young nurse he had snapped at earlier. Word of this incident spread quickly through the hospital, though the details became somewhat distorted in the retelling. Some staff members credited Sarah with performing a miracle, while others remained skeptical that any real change had occurred. Dr. Wellington himself seemed uncertain about what had happened, but he couldn't deny that the interaction with Sarah had affected him. Over the following days, Sarah noticed subtle changes in Dr. Wellington's behavior. He was still demanding and exacting in his professional standards, but the personal attacks and verbal abuse became less frequent. When he did lose his temper, he seemed to recover more quickly and sometimes even made brief apologies. The change wasn't consistent or complete. Dr. Wellington still had bad days when his old patterns reasserted themselves. But Sarah had proven that it was possible to interact with him professionally without triggering his worst behaviors. Her success encouraged other staff members to reconsider their own approaches. Jennifer Rodriguez, inspired by Sarah's example, began making small changes in her own interactions with Dr. Wellington. Instead of avoiding eye contact and speaking in nervous whispers, she started addressing him directly and professionally. To her amazement, he responded in kind, treating her like a competent colleague rather than an incompetent subordinate. The nursing staff began to realize that their own fear and defensive behavior might have been contributing to the toxic dynamic. Dr. Wellington had become accustomed to being treated like a dangerous predator, and he had learned to live up to that expectation. Sarah's different approach had shown him an alternative way of being. Dr. Amanda Foster from the emergency department noticed the change when Dr. Wellington came down for consultations. His communications were clearer and less confrontational. He still maintained high standards and expected quick responses, but he wasn't using intimidation tactics to get compliance. The hospital administration was cautiously optimistic about these developments, though they were careful not to celebrate too early. Director Patricia Mills had seen temporary improvements before, only to have Dr. Wellington revert to his old behaviors when the pressure increased. What made this change different was its source. Previous improvement efforts had come from above, through policies and training programs that Dr. Wellington had viewed as attacks on his competence and authority. Sarah's influence came from peer-to-peer interaction based on mutual respect and professional collaboration. Sarah herself was careful not to take too much credit for the improvements. She understood that lasting change would require Dr. Wellington to choose new behaviors for himself, not simply respond to her presence. Her role was to create an environment where such choices became possible and attractive. The real test came during a medical emergency that required the entire cardiovascular team to work together under extreme pressure. A patient had arrived with a massive heart attack, and every minute counted in determining the outcome. The situation demanded precise coordination and clear communication from everyone involved. In the past, such emergencies often brought out the worst in Dr. Wellington, as his stress manifested as anger toward anyone who didn't meet his exacting standards. The nursing staff would become so focused on avoiding his wrath that their performance actually suffered, creating a dangerous cycle of increasing tension and decreasing effectiveness. This time was different. Sarah took her position as the primary nurse coordinator and began managing the team's communications with calm efficiency. When Dr. Wellington barked an order that wasn't clearly understood, instead of cowering in fear, she asked for clarification in a straightforward manner that acknowledged his expertise while ensuring patient safety. Her example gave other team members the confidence to communicate more effectively as well. Questions were asked when needed, suggestions were offered when appropriate, and everyone focused on the patient's needs rather than on protecting themselves from verbal attack. Dr. Wellington found himself working with a team that was actually supporting his efforts rather than simply trying to stay out of his way. The difference was remarkable. His communications became clearer and more constructive as he realized that the staff was genuinely trying to help rather than simply avoid punishment. The emergency procedure was completed successfully, and the patient's life was saved. During the post-procedure debriefing, Dr. Wellington did something unprecedented. He thanked each team member by name and acknowledged their specific contributions to the successful outcome. The moment was witnessed by several other hospital staff members who happened to be in the area and word spread quickly through the building. For the first time in years, people were talking about Dr. Wellington in positive terms, focusing on his medical expertise rather than his interpersonal difficulties. Sarah understood that this single success didn't mean the problem was permanently solved. Real behavioral change required time and consistent reinforcement. But she had proven that it was possible for Dr. Wellington to work collaboratively with nursing staff when the environment supported such interaction. The key insight Sarah had discovered was that Dr. Wellington's aggressive behavior often stemmed from his own insecurity and fear of failure. His reputation for medical excellence was central to his identity, and any perceived threat to that reputation triggered defensive responses that manifested as attacks on others. By treating him with genuine professional respect and focusing on their shared commitment to patient care, Sarah had shown Dr. Wellington that he didn't need to use intimidation to maintain his authority. His medical expertise was sufficient to command respect from competent colleagues who shared his dedication to excellence. This realization began to change not just Dr. Wellington's behavior, but his entire perspective on workplace relationships. For the first time in years, he began to see nursing staff as allies rather than potential threats to his status and reputation. The transformation was gradual and sometimes inconsistent, but it was real. Other departments in the hospital began requesting Sarah's advice on dealing with difficult personalities, and nursing schools started using her approach as an example of how to maintain professional relationships in challenging environments. Most importantly, the quality of patient care began to improve as the cardiovascular team learned to work together more effectively. When medical professionals could focus on healing rather than self-protection, everyone benefited, especially the patients who depended on their expertise and collaboration. 3 months after Sarah Chen's arrival at Metropolitan General, the changes in Dr. Wellington's behavior had become impossible to ignore. The man who had once terrorized staff members was now engaging in actual conversations with nurses, asking about their weekend plans, and even occasionally smiling during routine interactions. The transformation wasn't just behavioral, it was fundamental. Dr. Wellington was beginning to rediscover aspects of his personality that had been buried under years of defensive aggression and professional isolation. The process wasn't always smooth, but it was consistently moving in a positive direction. The breakthrough moment came during a particularly challenging case involving a young mother who needed emergency heart surgery. The patient's husband was barely holding himself together in the waiting room, and their 2 small children were confused and frightened by the medical environment surrounding their mother. In the past, Dr. Wellington would have focused solely on the medical aspects of the case, leaving emotional support to other staff members while he concentrated on surgical preparations. But Sarah's influence had been gradually opening his awareness to the human dimensions of medical care. As they prepared for surgery, Sarah mentioned her concern about the family's emotional state and how it might affect the patient's recovery. She suggested that a brief conversation with the husband might help reduce his anxiety and, consequently, provide better support for the patient's healing process. Dr. Wellington's first instinct was to dismiss this concern as outside his area of responsibility. But he found himself reconsidering Sarah's suggestion, remembering how much clearer and more effective his communications had become when he started paying attention to the emotional dynamics of his interactions with staff. After a moment of internal struggle, Dr. Wellington made a decision that surprised everyone, including himself. He asked Sarah to accompany him to speak with the patient's family before the surgery. It was the first time in years that he had voluntarily sought out such an interaction. The conversation with the patient's husband was awkward at first, as Dr. Wellington struggled to find the right words for emotional reassurance rather than medical explanation. But Sarah's presence provided a model for compassionate communication, and gradually Dr. Wellington began to connect with the frightened man as one human being to another. He found himself sharing not just the medical facts about the surgery, but also his personal commitment to doing everything possible to ensure the best outcome. He talked about his years of experience, his success rates, and his understanding of how frightening this situation must be for the family. The husband's relief was visible as Dr. Wellington's words provided both medical confidence and emotional support. The children, seeing their father's reduced anxiety, began to relax as well. The entire family entered the waiting period with a sense of trust and hope rather than pure terror. The surgery itself went perfectly, but the real revelation came during the post-operative period. Dr. Wellington made several visits to check on the patient's progress, and each time he took a few extra minutes to update the family and answer their questions with patience and genuine concern. Sarah watched these interactions with quiet satisfaction, knowing that she was witnessing something truly remarkable. The emergence of Dr. Wellington's natural capacity for empathy and connection, qualities that have been suppressed by years of workplace trauma and defensive behavior. The change didn't go unnoticed by other staff members, nurses who had avoided DR. Wellington, for years, began seeking him out for professional consultations, finding him surprisingly receptive to their observations and suggestions. Medical residents discovered that he was actually an excellent teacher when he wasn't focused on intimidating them into submission. Dr. Amanda Foster was among the first to publicly acknowledge the transformation. During a department meeting, she mentioned how much more pleasant and productive her consultations with Dr. Wellington had become. Her comments encouraged other physicians to share similar observations, creating a positive feedback loop that reinforced the new behavioral patterns. The hospital's patient satisfaction scores began to improve in areas where Dr. Wellington worked regularly. Families commented on the excellent communication and compassionate care they received from the entire cardiovascular team. The toxic atmosphere that had previously characterized these departments was being replaced by one of professional collaboration and mutual respect. But perhaps the most significant change was in Dr. Wellington himself. As his relationships with colleagues improved, he began to rediscover his original passion for medicine. The joy and satisfaction that had drawn him to the profession in the first place started to re-emerge from beneath the layers of stress and defensive hostility. Sarah noticed that Dr. Wellington was staying later in the evenings, not because he was avoiding home, but because he was genuinely enjoying his work again. He would linger after surgeries to discuss interesting cases with residents, sharing his expertise in a way that built up rather than tore down the next generation of physicians. The transformation was also affecting Dr. Wellington's research work. His publications had always been technically excellent, but his newer papers began incorporating insights about the human dimensions of medical care. He started collaborating with colleagues in psychology and social work, exploring how emotional factors affected patient outcomes. One evening, as Sarah was finishing her shift, Dr. Wellington approached her with an unusual request. He wanted to know if she would be interested in co-authoring a paper about the relationship between workplace dynamics and patient care quality. It was the first time he had ever asked a nurse to collaborate on research, a clear indication of how much his perspective on professional relationships had changed. Sarah was honored by the invitation and accepted enthusiastically. Working together on the research project provided opportunities for deeper conversations about their shared commitment to healing and their observations about what made healthcare teams effective or dysfunctional. Through these discussions, Dr. Wellington began to open up about his own journey and the factors that had led to his previous behavior. He talked about the pressure he had felt to maintain his reputation, the isolation that came with being seen as difficult, and the defensive patterns that had developed over years of interpersonal conflict. Sarah listened without judgment, offering insights from her own experience working in high-stress environments. She shared stories from her military service about how trauma and pressure could change people's behavior in ways they didn't always recognize or control. Her understanding and lack of condemnation created a safe space for Dr. Wellington to examine and change patterns that had been causing him and others pain for years. The research they conducted together revealed fascinating connections between staff morale, communication patterns, and patient outcomes. Their paper documented how positive workplace relationships directly contributed to better medical care, providing scientific support for what Sarah had intuitively understood and demonstrated through her interactions with Dr. Wellington. The publication of their research brought positive attention to Metropolitan General Hospital and established both Dr. Wellington and Sarah as thought leaders in the field of healthcare team dynamics. More importantly, It provided a model that other medical institutions could follow to address similar workplace challenges. Hospital administrators from around the country began requesting consultations about how to replicate the transformation that had occurred at Metropolitan General. Sarah found herself traveling to speak at conferences and workshops, sharing her insights about treating difficult colleagues with compassion and professionalism rather than fear and avoidance. Dr. Wellington also became a sought-after speaker, though his presentations focused more on the medical and research aspects of their work. His transformation from feared tyrant to respected colleague had become legendary in medical circles, inspiring hope in institutions struggling with similar personality conflicts. The success of their collaboration led to additional research projects and the development of formal training programs for healthcare professionals. They created workshops on communication skills, conflict resolution, and building positive workplace cultures in high-stress medical environments. But beyond the professional recognition and career advancement, the most meaningful outcome was the genuine friendship that had developed between Sarah and Dr. Wellington. Their mutual respect had grown into personal affection and trust, proving that even the most damaged professional relationships could be healed with patience, understanding, and genuine care for each other's well-being. The ripple effects of this transformation continued to spread throughout Metropolitan General Hospital. Other departments began implementing the communication strategies and team-building approaches that had proven so successful in cardiovascular care. The hospital's reputation for workplace excellence began to match its reputation for medical expertise. Young medical professionals started specifically requesting positions at Metropolitan General because of its positive work environment. The hospital went from having trouble recruiting qualified staff to having waiting lists of excellent candidates eager to join their team. The transformation had created a virtuous cycle that benefited everyone involved in the institution's mission of healing and service. 2 years after Sarah Chun first walked through the doors of Metropolitan General Hospital, the institution had become a model for positive workplace culture in healthcare settings. The transformation was so complete that new employees found it difficult to believe the stories about Dr. Wellington's previous behavior. The man who had once been the most feared person in the hospital had evolved into one of its most beloved figures. Dr. Wellington now served as a mentor to young physicians, a valued collaborator for nursing staff, and an example of how personal growth could occur even in the most challenging professional environments. The success story had attracted national attention. Medical journals published case studies about the Metropolitan General transformation. Healthcare management textbooks included chapters on the Chun method of dealing with difficult colleagues. The hospital had become a destination for medical professionals seeking training in positive workplace dynamics. But for Sarah, the most meaningful measure of success wasn't the awards or recognition. It was the simple daily interactions she witnessed between Dr. Wellington and the staff who had once feared him. Watching him patiently explain a procedure to a new nurse or congratulate a resident on excellent patient care provided ongoing confirmation that genuine change was possible. The transformation had also revealed aspects of Dr. Wellington's character that had been hidden for years. His colleagues discovered that he had an excellent sense of humor, a talent for storytelling, and a deep well of compassion for patients and their families. These qualities had always been present, but had been overshadowed by his defensive behaviors and interpersonal conflicts. Dr. Wellington's personal life had improved dramatically as well. The stress that had made him irritable and aggressive at work had also been affecting his relationships outside the hospital. As he learned to communicate more effectively and manage his emotions more skillfully, his marriage strengthened, and his connections with his adult children were renewed. His wife, Margaret, often remarked that she felt like she had gotten her husband back after years of watching him struggle with workplace conflict that seemed to consume his energy and optimism. The man who came home from work now was tired, but satisfied rather than angry and frustrated. The research collaboration between Sarah and Dr. Wellington had expanded into a comprehensive program for improving healthcare workplace dynamics. They had developed assessment tools, training curricula, and intervention strategies that were being used in hospitals across the country. Their work had demonstrated that toxic workplace behaviors often stem from systemic issues rather than individual personality flaws. By addressing the underlying causes of workplace stress and providing people with better tools for communication and conflict resolution, dramatic improvements in both staff satisfaction and patient care could be achieved. The Metropolitan General Transformation had become a case study taught in business schools as well as medical schools. The financial benefits of the improved workplace culture were substantial. Reduced turnover, lower recruitment costs, decreased sick leave usage, and improved patient satisfaction scores all contributed to significant cost savings. But more importantly, the hospital had reclaimed its mission of healing. Staff members who had once dreaded coming to work now found genuine satisfaction in their careers. Patient care quality improved as medical professionals could focus their energy on healing rather than self-protection. The nursing staff, in particular, had experienced a remarkable renaissance. Jennifer Rodriguez had become a department supervisor, her confidence restored and her skills flourishing in the new positive environment. Michael Thompson had returned to school to pursue advanced certification, feeling supported rather than undermined by his colleagues. Young nurses and medical students were once again choosing to specialize in cardiovascular care, drawn by the department's reputation for excellence in both medical outcomes and professional development. The field was attracting the best and brightest candidates, ensuring that future patients would benefit from the highest quality care. Dr. Wellington had also begun mentoring other physicians who struggled with interpersonal relationships. His personal experience with transformation made him uniquely qualified to help colleagues who found themselves caught in patterns of defensive aggression and workplace conflict. His mentoring approach was based on the lessons he had learned from Sarah, treating people with respect, focusing on shared goals rather than personal grievances, and creating environments where everyone could perform at their best. He had become living proof that even the most entrenched behavioral patterns could be changed with the right support and motivation. The hospital's board of directors had recognized both Sarah and Dr. Wellington for their contributions to institutional excellence. But beyond the formal recognition, they had earned something more valuable: the respect and gratitude of countless colleagues whose working lives had been transformed by their example. Sarah had been promoted to Director of Nursing Professional Development, a position created specifically to expand her successful approaches throughout the hospital system. Her responsibilities included training new staff, consulting on workplace conflicts, and developing policies that supported positive professional relationships. In this role, she had the opportunity to work with medical professionals at all levels, from new graduates to department heads. Her consistent message was simple: everyone deserved to be treated with dignity and respect, regardless of their position or experience level. This principle, consistently applied, had the power to transform entire organizations. The success at Metropolitan General had inspired similar transformations at other healthcare institutions. Hospitals that had struggled with workplace toxicity began implementing the strategies developed by Sarah and Dr. Wellington, often with remarkable results. A network of healthcare institutions committed to positive workplace culture had emerged, sharing best practices and supporting each other's efforts to create healing environments for both patients and staff. The movement had grown beyond what anyone could have imagined when Sarah first decided to treat Dr. Wellington with simple human decency. The personal relationship between Sarah and Dr. Wellington had deepened into a genuine friendship built on mutual respect and shared purpose. They continued to collaborate on research projects and speak together at conferences, their partnership serving as a powerful example of what was possible when people chose cooperation over conflict. Their friendship had also extended to their families. Sarah's husband and children had developed warm relationships with Dr. Wellington and his wife. Holiday gatherings and social events provided opportunities for the personal connections that made their professional collaboration even more effective. Looking back on the transformation, both Sarah and Dr. Wellington were amazed by how much had changed and how relatively simple the process had been. The key insight was that most workplace conflicts were perpetuated by fear and defensiveness rather than genuine incompatibility between people. By choosing to respond with courage and compassion rather than fear and avoidance, Sarah had broken the cycle of negativity that had trapped Dr. Wellington for years. Her willingness to see beyond his angry exterior to the frightened and isolated person within had created possibilities that no one had imagined. The story of their transformation had become legendary within the medical community, inspiring countless other healthcare professionals to reconsider their approaches to difficult colleagues and challenging workplace situations. It proved that individual actions could create institutional change and that personal courage could overcome systemic problems. But perhaps the most important lesson was that everyone deserved a second chance to become their best self. Dr. Wellington's transformation from feared tyrant to beloved colleague demonstrated that no one was beyond redemption, no situation was hopeless, and no workplace culture was permanently toxic. The legacy of Sarah Chen's courage and Dr. Marcus Wellington's willingness to change continued to ripple outward, touching the lives of patients, families, and medical professionals who would never know their names but would benefit from the healing environment they had created together. Metropolitan General Hospital stood as proof that healthcare institutions could embody the healing they sought to provide for their patients. The transformation that began with one nurse's decision to treat a difficult colleague with respect had created a model for excellence that inspired hope throughout the medical profession. In the end, the story wasn't really about changing one person's behavior. It was about the power of human connection to overcome fear, the importance of courage in the face of adversity, and the possibility of creating environments where everyone could thrive. These lessons extended far beyond hospital walls, offering hope for transformation in any situation where people were willing to choose compassion over conflict and understanding over judgment.